Imagine a world where brain cancer was just a scary word, not a death sentence. Today we're going to travel back 4,000 years and fast forward all the way to 2026. This is the real story of brain cancer, from ancient roots to modern miracles. Let's begin. In ancient Egypt, around 4000 BCE, doctors already noticed brain tumors. They left behind skull bones with holes drilled in them and healed bone growths around the edges. A famous example is Skull 236. In the Duckworth Laboratory at Cambridge University, a man who lived between 2686 and 2345 BCE, doctors made small cuts and removed part of the tumor, showing that they were trying. Surgical treatment as early as 4,000 years ago. Greek physicians like Hippocrates, 460 BCE, wrote that brain tumors were incurable, which was completely true at that time. We didn't even know what a tumor was made of. Hippocrates focused on head injuries and listed brain problems, but he believed tumors were often hopeless. By the 1700s and 1800s, great anatomists like Andreas Vesalius mapped the human brain in perfect detail, but still, there was no real treatment. Doctors could only hope the tumor would stop growing by itself. Then came the breakthrough we needed. In 1879, a German pathologist named Rudolf Virchow studied brain tissue under a microscope and officially named the most common brain cancer, glioblastoma, and proved it was a true tumor. That was the moment doctors realized brain cancer was real and very dangerous. He studied many cases and showed that gliomas came from the glial cells that support the brain's nerve cells. For the next 60 years, nothing much changed. Surgeons tried to cut out the tumor, but the brain is so delicate that cutting it often caused more damage than the cancer itself. The first successful brain tumor removal happened in 1884 by a surgeon named Rickman Godley, but most patients still died quickly. The real revolution started in the 1940s. Doctors began using radiation therapy, first with X-rays, then with higher energy beams. They could finally shrink the tumor and give patients some extra months. This was the first time anyone could attack the cancer from outside the brain. In the 1960s, doctors tried chemotherapy directly into the brain, but the side effects were terrible and it was hard to control. Then, in 2005, everything changed forever. A famous study at the University of Texas showed that combining radiotherapy with the drug temozolomide doubled survival from 12 months to 14 to 15 months. This became known as the Stupp protocol, and it's still one of the most important brain cancer treatments used around the world today. For many patients, that simple combination saved their lives. Now fast forward to 2026. Brain cancer treatment has become truly personalized and even hopeful for some patients. Here are the powerful tools we have today. First, targeted drugs. If the tumor has a specific mutation, doctors can give a medicine that attacks only that mutation. For example, vorasidenib is now delaying progression in IDH mutant gliomas by more than 17 months on average. Osimertinib is used for certain brain tumors and can stop the cancer from growing for months or even years. These drugs are changing the game because they hit the cancer's weaknesses instead of hurting the whole body. Second, immunotherapy. CAR T-cell therapy is now being used in brain cancer clinical trials. Doctors take some of the patient's own white blood cells, teach them to fight cancer, and then put them back into the brain. This is like training an army to attack cancer cells from inside the body. In 2025 to 2026 trials, B7H3 directed CAR T-cells showed 44% disease control in recurrent glioblastoma, and some patients are living much longer. For children, tumor-associated antigen T-cell therapy has shown incredible results. One boy stayed cancer-free for over 2.5 years. Other patients are getting dual-target CAR T-cells that slow tumor growth in 62% of cases. These new immunotherapies are giving hope to families who thought nothing could help. Third, Tumor Treating Fields. A special hat called Optune is worn every day for 18 hours. It sends weak electrical fields that stop cancer cells from dividing. Many patients see their tumors shrink or stop growing completely. Studies show it adds extra months of life even with other treatments. Fourth, liquid biopsy. Instead of doing brain surgery just to get a sample, doctors can now take a simple blood test and find cancer DNA in minutes. This tells them exactly which drugs will work best and helps avoid wrong treatments. And finally, gene sequencing and new therapies. Every tumor is tested for thousands of genes. The treatment plan is made based on that, not just chemo and radiation. New drugs like sonodynamic therapy have extended median survival to 15.7 months in recurrent, high-grade gliomas. Oncolytic viruses like TACA-511 combined with an antifungal drug have increased survival to 13.6 months. Sugar-coated nanoparticles are being tested to deliver special mRNA directly into cancer cells and restore tumor-suppressing proteins. For low-grade gliomas and IDH mutant tumors, temozolomide plus radiotherapy is now giving 5-year survival rates of 94% and 10-year rates of 80%. In some groups, numbers that were impossible just 20 years ago. So the survival rate for glioblastoma patients has gone from less than 5% in the 1970s to over 35% in the last 20 years for many patients. For some types of brain cancer, like certain meningiomas, more than 90% of patients live 5 years or more. Even in the most aggressive cases, new combinations are pushing median survival from 8 months to 15 months and beyond. The next time someone says brain cancer, remember this: it is no longer the same hopeless disease it was 100 years ago. Science has turned a death sentence into a treatable condition, sometimes even a curable one. So the next time you hear the word brain cancer, don't run away. Learn, support, and fight together. Thank you for watching. If you want to help brain cancer patients, please share this video. Subscribe and turn on notifications so you never miss important medical updates. Sources: National Cancer Institute, American Brain Tumor Association, Kutru's Statistical Report 2025, Society of Neuro-Oncology 2025 presentations, UCLA Health, OncLive, and leading medical journals from 2025 to 2026.